A patient today asked about a medication called Trazodone. Trazodone is an older antidepressant that is often now used for sleep. In fact, it's probably the most commonly prescribed sleep medication that I'll write for patients if they're having difficulty with insomnia. So as an older antidepressant, people are often confused. Why would you write an antidepressant for someone for sleep? Well, a lot of the medications that are traditionally used for insomnia have quite a bit of abuse potential, and they can also cause quite a bit of physiological dependence. They often, like medications like benzodiazepines or derivatives of benzodiazepines. So the benzodiazepines are medications like Klonopin or clonazepam, Xanax or alprazolam, Ativan or lorazepam, Valium or diazepam, and then some of your derivatives like Ambien or Zolpidem or Lunesta. It's another benzodiazepine derivative. Those medications, you can't drink any alcohol if you take them. They have an additive effect with alcohol. They can cause physiological dependence. They're actually depressants, so they can make someone more vulnerable to depression if they're taking them consistently or taking them at high doses. There are actually several different medications like Trazodone that are older antidepressants that never really caught on as primary antidepressants, basically because they just make people feel too tired. And so for Trazodone, as an example, a typical dose for insomnia would be 25 to 50 milligrams taken as an individual is getting into bed. And I say that because if you take this medication and then you stay up and watch TV or you're on your cell phone or looking at a screen, after half an hour, 45 minutes or so, you kind of lose your window in terms of where it's going to help you to fall asleep. But anyway, you take it as you're getting into bed, and it often will help someone fall asleep a little bit faster or sleep a little bit more sound during the course of the night. And the doses we're talking about, for depression, someone might be on 300 or 400 milligrams or so with Trazodone as an antidepressant. And again, for insomnia, I'll typically prescribe 25 milligrams or 50 milligrams. So just a fraction of a dose. And while Trazodone isn't purely an SSRI, it's very similar to your SSRIs in terms of side effects and tolerability. And so it's what I would consider a pretty low risk medication for someone to take. With that being said, it does have a black box warning for suicidality, and it's also a medication where it's known for a potential, it would be relatively rare, but it does have a potential to cause something called a priapism, which would be an erection lasting more than 4 hours that an individual will need to seek medical attention for. And so if you go on this medication, you want to make sure that you're properly consented and you understand that, and if that does happen, you get to a hospital or urgent care right away, because that could cause serious problems. Especially for someone who is younger and is planning on having children. You don't want to do anything that could jeopardize that, obviously. Very rare side effect, but I do want to mention that. There are lots of potential other side effects with this medication, and if you feel that this pertains to you or have any additional questions about it, be sure to talk to a medical or mental health professional about Trazodone and about insomnia. But again, it may be a very safe medication. Overall, a lot safer than your benzodiazepines or other medications that are controlled medications and have more abuse potential.